Good day everyone, I'm Dr. Bevin. I head the emergency department at Sakra World Hospital. In order to ensure a very efficient process within the emergency room, we implement something called as triage. So triage is something which is done when the patient arrives to the emergency room. A nurse or a doctor will see the patient first and decide whether this patient needs immediate care or this patient can wait for a bit. If it's something which is related to, say for example, if it's a seizure or if it's a cardiac arrest, those are immediately taken into the resuscitation zone and those are taken care of immediately. Let us say it's an ankle sprain or it is a minor cut without any major bleeding has come. In that situation, we will do an immediate some sort of a dressing or something of that sort, and then the patient will be asked to wait for some time before x-rays and all those other things get done. So usually it's more of a patient-based priority. Like, we don't go with the mindset that this patient should wait or this patient should go ahead, but it just depends on the priority. See, in the emergency room, it doesn't work like a VIP goes in or somebody who goes inside. No, emergency is a major equalizer for everything. So when that happens, no matter whatever it is, your condition decides whether you get seen first or you get seen later. So that is a fair process because you are dealing with a human condition wherein you are actually going and assessing what the situation is. And based on that situation, you're going to think, is this going to cost a life or a limb? In that case, that is going to be given priority. If this is not going to cause any long-term consequences or there is no other problem associated with it, that is given a lesser priority and it is there. We triage with 5 categories. So we follow something called as the ESI or the Emergency Severity Index. And based on that index, we decide, based on the resources that are available and the kind of people that come to the department, based on that, we will triage. And in my experience, what I've noticed is the ones who are really sick will have there's no question of any wait or anything, they will get their treatment. But often people have to wait and that is viewed as a pain point sometimes. But there is nothing personal. It is being done so that the best service is given to the ones who deserve first and thereafter the rest is addressed. It's important to communicate well during this process so that people don't expect that when they come to the emergency room. So we make it a point to tell them that yes, you might have to wait for a little bit while your x-rays etc. get done.